Okay, today I'll be talking about cholecystitis. Cholecystitis is inflammation of the gallbladder. There's four different types. There's acute, chronic, calculous, and acalculous. Calculus is related to gallstones. Acalculous is not related to gallstones. Calculus is the most common type. Acute is sudden and urgent. Chronic is slow and long-standing. Gallstones are pieces of hardened bile tissue or cholesterol that has crystallized, and traveling can cause blockages in bile ducts, which results in bile backup and infection. Um, a acalculous type of cholecystitis is biliary stricture, which is where chronic inflammation leads to scar tissue that can obstruct the flow of the bile in the bile duct. And then bile dyskinesia is where the gallbladder doesn't contract enough. And so that gallbladder sits there and accumulates and hardens and then turns into gallstones. So that would be a calculous version of cholecystitis. And then as well, you can also have cancer or HIV and AIDS that can cause cholecystitis as well. Some biological risk factors for cholecystitis is pregnancy and being female, which both of those are related to our reproductive hormones. Age, where you're older than 40, and being Hispanic or Native American descent. These people have genes that promote efficient calorie and cholesterol utilization and storage. So since they're able to use that cholesterol more is bioactively available to them, and it means it can crystallize better there's more of it to crystallize in the gallbladder. And then some lifestyle risk factors, obesity, so increased cholesterol and bile, impaired gallbladder function, diabetes, so having high triglycerides or reduced blood supply to the gallbladder can both cause cholecystitis. High cholesterol, like I said earlier, that bile becomes super saturated with cholesterol, which forms crystals or gallstones. And then rapid weight loss, and this alters bile composition and slows gallbladder function. Some nutrition-related history. So nutrition needs for people with cholecystitis is having a high fiber, healthy fat diet. And so high fiber, you can do fruits, vegetables, beans, peas, lots of whole grains. So using brown rice and oats and whole wheat bread. On the opposite end, limit those refined carbohydrates and processed sugar. And then that kind of goes in hand with diabetes and obesity. And then prioritizing those healthy fats, so those unsaturated fats from fish and olive oil. And by also avoiding saturated fats. It's important to still get fat from unsaturated sources because your gallbladder still needs to contract and empty that bile on a regular basis, so that there isn't that accumulation of um bile, which then hardens. So that's something to keep in mind. And then some common medications for people who have cholecystitis are antibiotics that treat the infection, pain relievers, anti-nausea medicine, and then oral bile acids, which dissolve those cholesterol gallstones. And this is important to mention that it also affects the absorption of those dietary fats and the fat-soluble vitamins and minerals, which I'll talk about later. Some anthropometric measurements to keep in mind are BMI, central adiposity measurement, so waist circumference, waist to hip ratios, and waist to height ratios. Those all have to go hand in hand with obesity. And then weight changes. So rapid weight gain, which has to do with obesity, and then rapid weight loss, which I talked about earlier about how it slows down gallbladder function. And then sex, which is something I've already talked about as well. So female versus male. Females are significantly more likely to develop gallstones due to our reproductive hormones. Some biochemical data. So here are some labs that the healthcare team will probably look at. Two of them marking inflation would be C-reactive protein and complete blood cell count. So specifically looking at those white blood cell counts, both of those will be elevated. You can also look at some liver function tests because again, the liver is what makes the bile, but the gallbladder is what stores that bile. So the liver and the gallbladder kind of go hand in hand. And you're likely to see high levels of bilirubin and ALP in the blood. And then you're more likely to see decreased levels of our fat-soluble vitamins in the blood, specifically D and E, because since the gallbladder is not sending off enough bile to absorb the fat, you're not going to be able to absorb those fat soluble vitamins. And then some other biochemical data you can look at is some radiology things. So here, the healthcare team is looking for gallstones, thickened gallbladder wall, and enlarged bile ducts. You can do that through ultrasound, CT scan, and you can also inject a radioactive chemical to see the flow of the bile. And here is an example of an ultrasound that I found very interesting. So on the picture on the left is a normal gallbladder. You can see the thin wall. Here's the liver. And then the picture on the right is an inflamed gallbladder. So you can see that that wall is a lot thicker, and there's the liver right there. And so, I don't know, it's just interesting to see the difference there in the ultrasounds, which I thought was pretty cool. And then some things with nutrition-focused physical exam. So one thing to look for is a positive Murphy sign. And that is where you press on the upper right abdomen and you look for tenderness and pain. And so if you have tenderness and pain, that's a positive Murphy sign. That means you're likely to have some sort of gallbladder issue. You can also have fever and jaundice, fever coming from the inflammation, jaundice coming from the liver things. Digestive symptoms, bloating, loss of appetite, nausea, vomiting, and then light colored stool. This can come from your body not absorbing those fats, and so they come out in your stool. So your stool is likely to be very light in color and almost greasy. And then some more nutrition focused things, looking at fat stores and muscle mass. So deficiency in digesting energy or triglycerides, you're going to lose weight. And so those are some things to look at, or those fat stores, maybe underneath the eyes, muscle mass. And then hair and skin. So looking at deficiencies in fat soluble vitamins A and E, which have to do with hair, skin, and nails. So maybe having thin or brittle hair, thin or brittle nails, and then your skin just being thin as well. And then some questions that you can ask the client, previous episodes of pain or digestive comfort, previous diagnoses of gallstones that can look at whether this is acute or chronic. Any recent rapid weight loss, that's a risk factor. Another risk factor is family history, comorbidities as a risk factor. So liver disease, diabetes, or Crohn's. Dietary habits, we can look at their recall and kind of see what their fat intake looks like, whether it's saturated or unsaturated fats. Whether they're eating enough fiber or enough whole grains, what their protein sources look like, if it's lean meat or high fat meat. And then females, if they've been pregnant or are using birth control, that can affect our reproductive hormones. And then comparative standards. So during a flare-up, food and fluid intake may be restricted to allow the gallbladder some time to rest or recover. When ready to begin eating again, you can kind of stick around the same energy and protein needs. So you can still stick around the Mifflin with activity factor and then 0.8 grams per kilogram for a healthy adult for protein. What's important is that your fat intake needs to be about 25% of calories, so a little bit lower, but these fat sources need to be unsaturated and high quality. So that's your fish, that's your olive oil, things like that. And then with your protein, you want that lean, low fat meat like fish or poultry. Fluid needs, unless you're having diarrhea or vomiting, you can consume this normal amount of water, 1-to-1 ratio. And then micronutrient needs, there's a potential need for a fat soluble vitamin supplement if you're still not digesting your fat properly. Because if your body can't absorb that fat, there's no way the body can absorb those fat soluble vitamins. And then here's some common nutrition diagnoses for people with cholecystitis. Malnutrition, impaired nutrient utilization, altered nutrition-related laboratory values, excessive fat intake, inadequate vitamin intake, A, D, and K, altered GI function, overweight or obesity, and limited adherence to nutrition-related recommendations. And that has to do with the pictures on the right here. So the first picture is saturated, a lot of saturated fat, whereas the lower picture is a lot of unsaturated fat sources. And then some nutrient intervention. So for a short time, you're probably going to be NPO. That gives the GI system and gallbladder some time to rest. If you're NPO long-term, that's when you need your parenteral nutrition. But that really isn't going to happen a lot for these like simple cases of cholecystitis. What you're more likely going to see is maybe NPO for overnight or something, and then maybe throw in an enteral product, and that will help still give your body some nutrition, but give the gallbladder and GI system a chance to kind of take it easy for a little bit. If things get really, really bad, you can always get your gallbladder removed. It's a non-essential organ. Again, it just stores bile, doesn't make bile. So that's just, it's doesn't really change your diet a whole lot. You just have to be more mindful about the type of fat that you're eating. And then if you're really, really into doing strictly nutrition intervention, you can do a lower fat diet with a fat soluble vitamin supplement. And this is, again, keeping that fat intake a little bit lower than what you normally would. Emphasize those unsaturated fats like fish and olive oil and limit those saturated fats. You can also do some patient education on why consumption is the right type of fats. Why consumption of the right type of fats is important for nutrient absorption. So again, focusing on those unsaturated fats, maybe having a lower fat diet, but you can't take away fat completely because your gallbladder still needs to be able to have a reason to contract and let that bile out and absorb those fats. So monitoring and evaluation. So some things to monitor is that Murphy sign, so the pain of the upper left quadrant, color and consistency of stools. Like I said, pale and greasy means that you're not absorbing fat very well, which means you're not absorbing those fat soluble vitamins very well. All of your labs you can look at again. We'd want to keep our white blood cell count and our C-reactive protein lower, and your bilirubin and ALP, so your liver functioning tests, lower. And that all means that your gallbladder is functioning well. There's no signs of inflammation. You want to keep your fat soluble vitamins higher and keep them up. And that means that the gallbladder is working, it's releasing that bile. You're absorbing those fats, which means you're absorbing those fat soluble vitamins. And then we can always do radiology things again. So ultrasound, CT scan, that injection of radioactive chemicals to look for those gallstones and thickened gallbladder wall and enlarged bile ducts. Some risk factors that we can continue to evaluate are pregnancy and age. As you age, you're more likely to have gallstones, so we can keep that in mind. And then more so is the lifestyle risk factors. So we can work on lowering our obesity, managing our diabetes really well, and both those can be done through diet, and keeping our cholesterol lower, because then again, you're not going to have super saturated bile, which means that those crystals aren't going to form. And then watching our rapid weight loss. So with obesity and diabetes, you can do slow and steady weight loss, and that'll help lower those risk factors a little bit. But again, with that rapid weight loss, we have to be careful about how much weight we're losing, and how quickly we're doing that, because that can alter our bile composition and slow gallbladder function. Here are some potential enteral products that can be used for people with cholecystitis. I wanted to focus on formulas that are high protein, fibrous, have medium chain triglycerides, and are lower in fat, because the time to drink these would be, or use these would be when you're still trying to take it easy on the GI system. Two different types that you can use I found were Vivinex and Peptamen. Vivinex kind of was on the lower side of fat, and so there's a 10% kcal from fat and 6% kcal from fat options. And both of those I think are for the more extreme cases of cholecystitis, because those low fat, you're still giving the gallbladder a reason to contract, but you're not overloading it. Whereas with Peptamen and Peptamen AF, those ones you have high fiber. Well, Peptamen AF you have high fiber, but both of those you have those medium chain triglycerides, which can help with. They're a little bit easier for the body to digest. So that's another great option there. And here are my references. Thank you.